Hi, my name is Catherine. I'm going to do a video for my obstetrics 508 course. My topic of discussion is breast surgeries and how they can impact breastfeeding for the woman and the infant. So here I have my patient,
Hello.
Justina, and she has recently underwent a breast augmentation surgery, and she has a few questions regarding breastfeeding and how it will affect the infant and her sessions and her attempts for breastfeeding. So she has some questions for me today that I can answer.
Okay, so I will start with the first question. The first question is, does breast surgery or breast augmentation have any impact on the breastfeedings?
So breast surgery may have an impact on breastfeeding due to a severed inversion of the nipple and areola. Depending on what kind of breast surgery you have underwent, statistics show that actually breast augmentation surgery has less likely of a chance of impacting breastfeeding for a woman in regards to breast reduction surgery that does pose a greater risk for complications later on in life. So breast augmentation has grown rapidly in popularity. So the silicone gel is being used 60% of the time in patients. So breast augmentation is less likely to impede breastfeeding. And with women who have undergone breast surgery in the past, they're 3 times more likely to have lactation insufficiency and have low milk supply. So they will be needing a consultant to help them through those problems and to figure out a solution in those kind of complications.
All right, so I will move to the next question. So the next question is, what are the potential risks for breastfeedings as a woman who has underwent a breast augmentation?
So some potential risks that can arise from breast surgeries can be low milk supply. It can be inhibited letdown because of the loss of sensitivity in the nipple. So just depending on what type of incision, it can impact the milk production in the breast. So another potential risk is mastitis. So it is a painful inflammation of the breast tissue that can increase the potential of pain as well as sore nipples and as well as engorged breasts that can be due to overfilled milk in the breast.
Mm-hmm. All right, the next question. Will breast implants affect milk production?
So when it comes to milk production, a lot of the questions that we do ask our patients is what kind of surgery they underwent. So that will kind of indicate the type of incision they had. So some surgical techniques cause more damage to milk ducts, glandular tissues, and nerves other than other techniques. So incisions around the areola can be more likely to sever milk ducts and affect nerves that play a role in breastfeeding. So it depends the surgeon, the type of incision made, and how much damage has been made to your breast, and what we can do to provide a consultant and to find a solution to your problems.
Mm-hmm. All right, so the last question is, could my breast implants harm my baby?
So not much conclusive evidence has been done on this topic, but for the research that is clinical based and that has been done in the past has shown that there hasn't been any reports of problems for infants or mothers in regards to their breast implants and any kind of impact they have on their baby or breastfeeding. So in regards to those statistics, I think no, it cannot harm your baby.
All right, thank you very much for answering my questions.
All right, thank you so much, Justina, for talking with me, and I hope that in the future you have success in your breastfeeding and your breast augmentation is successful. So thank you so much.
Much appreciated. Thank you.
Beautiful.